I'm gonna take my time. She gon' get hers before I'm gonna take it slow. I'm not gonna rush the stroke, so she can get a sexual eruption. So I can get a sexual.
Hi there, I'm Diogo Hausen. You may remember me from other educational videos such as Kent Bruno's Guide to Bathtub Whiskey and Tax Evasion, or Thirsty Larry's Questionably Legal Spring Break. But today I'm here to talk to you about a very serious subject. Sexuality. And since most of you are acupuncturists, you've probably never had a class on any sexual dysfunction. We will give you a brief explanation of these disorders, just so you don't look like a damn fool in front of your patient. Okay, let's do this. Starting off with my first guest, penis expert, Dr. Mo Bonner.
Erectile dysfunction is difficulty getting or maintaining an erection. It usually happens in men over 75, but it can happen at any age. My friend suffers from erectile dysfunction. Here is the graphic footage. ED can manifest in several different ways. Difficulty getting an erection, difficulty maintaining an erection, and reduced sexual desire. There are multiple causes for ED, including health problems that affect the heart and blood vessels and need to be treated to help prevent more serious problems. Unhealthy lifestyle habits can also contribute to ED. Anything that's bad for your heart is also bad for your sexual health. Other medications, medical conditions or procedures, and also emotional causes. Many but not all men take a pill to treat ED. These men should still treat their underlying health condition. And additional treatment options include injections, urethral inserts, a vacuum device, and a surgical implant. Premature ejaculation occurs when a man ejaculates during sexual intercourse before he or his partner would like. As long as it happens infrequently, it's not a cause for concern. However, if one consistently ejaculates sooner than desired, such as before intercourse begins or immediately afterward, it can be considered premature ejaculation. Premature ejaculation is a common sexual complaint. Estimates vary, but as many as 1 out of 3 men may be affected by this problem at some time in their lives. Both psychological and biological factors can play a role in premature ejaculation. Although many men feel embarrassed to talk about it, premature ejaculation is a common and treatable condition. Medications, psychological counseling, and sexual techniques that delay ejaculation can improve sex for you and your partner. For many men, a combination of treatments works best.
Thank you for sharing your home sex tapes with us, Dr. Bonner. Sex addiction has been getting a lot of attention in the media with the golfers and the tiger blood and whatnot. But what does it really mean? It is under consideration to be added to the DSM as hypersexual disorder, not sex addiction. 14 hours a week or 2 hours per day of doing some form of sexual activity could put you in the ballpark, whether it's online pornography, cruising for prostitutes, or seeking out sexual partners. Now you may say, manly narrator, I just got myself a shiny new significant other, and we have been engaging in sexual activity most frequently. Well, it has to cause you distress. Let's observe. Does this look familiar? You wanna have sex?
Again?
Yeah! Well, good for you. But if things start looking like this... Y'all need to get the fuck out! Then it might be time to seek some help. The same applies to online sex. Here, Mikey uses internet pornography in a healthy way.
Yo, Mikey, you wanna go and throw the beer around?
Sure, I can masturbate later!
Alright!
That's within acceptable parameters. Now if online sex turns into this... It it may be time to seek some help. It is important to note that sex addiction is rarely just about sex. It is related to issues of power and control. Luckily, treatment is available through 12-step programs and therapy. Although hypersexual disorder isn't in the DSM, its exact opposite is. The DSM defines it as low libido, to the point where it causes distress and is not due to a different disorder such as depression or you're in a coma or something. If it happens infrequently,
You wanna have sex?
not today, the clinician might not see it as a disorder. But in this case,
So do you wanna have sex?
no. Then it might be hypoactive sexual desire disorder. Sometimes hypoactive sexual desire disorder gets confused with sexual arousal disorder.
Don't make that mistake.
To further clarify, here is our local specialist, Lady Doctor.
I am going to talk to you about commonly referred to as Candida syndrome. This disorder is characterized by a persistent or recurrent inability to attain sexual arousal or to maintain arousal until the completion of a sexual activity. This diagnosis can also refer to an inadequate lubrication or swelling response normally present during arousal. This disorder is not to be confused with female orgasmic disorder or hypoactive sexual desire disorder. There are many psychological and physical factors causing the disorder. Psychological factors include childhood and adolescent experiences and current events, individual factors including stress, fatigue, gender identity, health, poor body image, self-consciousness, and lowered self-esteem, and dysfunctional sexual beliefs. Physically, some factors are circulatory or neurological dysfunction, cardiovascular illnesses, mostly in men, but can also be in women, and increased level of inhibition with arousal stimuli. I am going to talk to you about symptoms include persistent recurring inability to have orgasms, distress and dissatisfaction in personal relationships, anxiety and fear regarding sexual performance, lack of interest in sex, which include feelings of disappointment and frustration, and symptoms present even during masturbation. There are physical causes, and there are psychological causes. Vaginismus is involuntary spasms of the muscles close to and surrounding the vagina. There are psychological and physical factors causing the disorder. Women with vaginismus often become anxious about intercourse. However, this does not mean that sexual arousal cannot be achieved. Treatments include education, counseling, Kegel exercises to contract and relax the pelvic floor, and vaginal dilation exercises using plastic dilators with the help of a sex therapist or other healthcare provider. This therapy should involve the partner, which can ultimately lead to intercourse. When women are treated by specialists, success rates are generally very high.
Thank you, Lady Doctor. Now, vaginismus can often get confused with dyspareunia, but only if you don't know what they are. Fun fact, the word stems from the Greek meaning bed partners not fitting together. Recurrent or persistent genital pain associated with sexual intercourse, either a male or female. It causes distress and is not better explained by some other disorder. Since studies show that the same pain can be recreated during non-sexual situations, such as putting in a tampon, during gynecological exams, before having a first sexual encounter, and during sports, many would argue that this does not belong in the sexual disorder category, but rather just as a pain disorder. But I'm not here to talk politics and mathematics. I'm here to show videos. Prepare for graphic Awkward transition right into paraphilia. Let's talk about them. Better yet, let's have someone else talk about them. Here is someone else.
Previously referred to in the DSM as sexual deviation, the list of paraphilias has now become enormous and includes paraphilias such as autozoophilia, dendrophilia, forniphilia, somnophilia. Pedophilia involves prepubescent children. That needs to be reported to the police. A sexual fetish may be regarded as an enhancing element to a romantic or sexual relationship, achieved in ordinary ways, or as a disorder if it lasts longer than 6 months, and causes significant psychological distress for the person or has detrimental effects on important areas of their life. It is sufficient for the diagnosis if one of the participants is being hurt or mistreated in any other way.
Exhibitionism is involving the exposure of one's genitals to an unsuspecting stranger. Observe. Keyword: unsuspecting strangers. If they were expecting it, it wouldn't be much of a disorder. It'd be a regular day in San Francisco. Voyeurism has the same criteria, but is involving the act of observing an unsuspecting person who is naked in the process of disrobing or engaging in sexual activity.
Frotteurism refers to a paraphilic interest in rubbing, usually one's pelvis or erect penis, against a non-consenting person for sexual gratification. It may involve touching any part of the body, including the genital area. If you are experiencing frotteurism, you may consider a body pillow. Transvestic fetishism is recurrent, intense, sexually arousing fantasies, urges, or behaviors involving cross-dressing. This, however, is not to be confused with gender identity disorder. Transvestic fetishism is only diagnosed in heterosexual males, and most men with transvestic fetishism do not have a problem with their assigned sex. This is a controversial topic now, as the World Professional Association for Transgender Health wants the definition to be refined for the DSM-5. The new diagnosis is transvestic disorder, defined by 2 criteria: recurrent, intense sexually arousing fantasies, sexual urges, or behaviors involving cross-dressing. And the fantasies, sexual urges, or behaviors are causing clinical distress or impairment in important areas of psychological functioning. That is, the distress is not solely due to external prejudice, stigma, or oppression. Treatment for paraphilias include a combination of psychotherapy and medications. Now onto the topic of sadomasochism.
Girl? Oh, no you didn't. Ah! And now onto the subject of sadomasochism. Here's some massive chunks of writing. Please read them on your own time. Basically know that both conditions require at least a 6-month period with recurrent, intense, sexually arousing fantasies, sexual urges, and behaviors. In masochism, these urges involve the real acts of being humiliated, beaten, bound, or otherwise made to suffer, while in sadism, the psychological or physical suffering is sexually exciting to the person. When the fantasies, sexual urges, or behaviors cause clinically significant distress or impairment in social, occupational, or other important areas of functioning.
I see you missed your last appointment, and you can take your herbs. You need to be punished.
I want these to make it hurt.
Then it can be considered a disorder. It is important to note that S&M can be maintained in a healthy level so long as it does not interfere in social or occupational situations. Hi, honey, I'm home.
All right, Daddy. Righteous.
In 1952, the first DSM listed homosexuality as a sociopathic personality disorder, defined as people displaying antisocial behavior with a lack of moral conduct and are unable to conform to the norms of society. When the DSM-2 was released in 1968, homosexuality was listed as a sexual deviancy. The DSM had a definition of homosexuality. It was considered to need treatment. In 1973, the APA removed homosexuality from the DSM-4 entirely. The APA's membership voted to put it back in, but only 40% voted to approve it, so it failed, and has stayed out of the DSM ever since. Here is an example of how homosexuality is viewed now. Oh, remember, tomorrow night we have to go to dinner at the baker's.
I hope it's not another quiche.
Lastly, with the creation of the Kinsey scale, homosexuality for men and women was defined as a scale from 0 to 6. 0 is entirely heterosexual. 6 is entirely homosexual. And 3 is equally hetero and homosexual. Gender identity disorder is a disorder in which a person does not identify with their own biological gender. It can be identified in both children and adolescents and adults. In order for someone to be diagnosed with gender identity disorder today, they must exhibit the following symptoms. It's a strong and persistent cross-gender identification, not merely a desire for any perceived cultural advantages of being the other sex. It is not concurrent with a physical intersex condition. In children, gender identity disorder can be identified if 4 or more of the following 5 symptoms are observed. 1. Repeated desire or insistence that one is the opposite gender. 2. Insistence or preference for dressing in the stereotypical attire of the opposite gender. 3. Preference for cross-sex roles in make-believe play or fantasies about being the opposite sex. 4. Intense desire to participate in stereotypical games and pastimes of the opposite sex. And 5. Preference for playmates of the opposite sex. In adolescents and adults, gender identity disorder manifests as a stated desire to be of the opposite sex, passing for the opposite sex, desire to live or be treated as the opposite sex, or feeling they have the emotional reactions associated with the opposite sex. Also, feeling uncomfortable with one's own sex and or the gender role associated with that sex. Here is my special guest, gender studies expert and transgendered man.
Gender identity disorder is as unnecessary of a diagnosis as homosexuality. Its existence is an example of ignorance toward gender expression and identity, therefore diagnosing mentally healthy individuals as having a disorder when their gender identity or expression simply differs from the societal norm. Society identifies 2 extreme ends of the gender spectrum as being normal, while most, trans or not, fall somewhere in between. While it is viewed as a way to ensure a person is making the right decision for them, it's often used to prevent individuals whose identity differs from their physical appearance from living a happy, healthy life. Labeling people with varying gender identities as having a disorder creates a societal stigma around gender identity and expression, contributing to the ignorance and hate surrounding the subject. Gender expression itself is a societal construct, and labeling those who don't view the construct in the same way as mentally ill is a misuse of the label.
And please, don't forget Rachel's helpful tips for interacting with gender nonconformist patients.
Astounding. Thank you, Doctor. Those are the disorders. Now, we'd like to talk to you on a more serious note about sexual trauma.
Sexual trauma can be violent or have no violence at all. It can be a single event or a series of events that may escalate over time. It can be sexual harassment, rape, inappropriate touching, being pressured to perform or engage in sexual activity, or threat of harm if you do not do a sexual act.
Many people think that sexual trauma has to be violent to be traumatic, but in fact, a majority of sexual assaults that occur do not have any violent behavior, but instead are done with a threat of harm or embarrassment for the individual involved. Sexual trauma is traumatic, when the persons involved feels a sense of fear, helplessness, injury, or threat of injury.
A person's response to sexual trauma will change as time passes. It is common to have feelings of fear, grief, sadness, physical feelings of nausea, dizziness, changes in appetite, and changes in sleep patterns. Reactions to the sexual trauma can last for weeks to months before you start to feel normal again.
Most people report feeling better within 3 months after the sexual trauma. However, if the feelings become worse or last longer, there may be signs of suffering from PTSD or depression.
There are many physical, cognitive, emotional, and behavioral reactions to trauma that are important to recognize. If you have patients that may be suffering from sexual trauma, it is your responsibility to give them proper referrals to mental health professionals as well as resources to keep them safe. Now people will be coming to you for intimate issues. It's important you know how to handle these issues and not seem like an insensitive asshole. How can you do this? Just follow these simple steps. Respect your patient's gender and sexual orientation. Recognize but do not diagnose patients with these disorders. You are an acupuncturist, not a therapist, so know when and where to refer. Don't judge your patients. They are there for help, so be there for them. Don't be suggestive, inappropriate, or hit on your patients. Seriously, keep it in your pants. And finally, just go by the golden rule. Treat others as you would want to be treated. Here are some examples of some situations you might find yourself in.
Do you like sex?
I guess?
Okay, that was pretty bad.
How is your libido?
Not so good.
How about now?
That's even worse. I don't even know how that's possible. That's how you get sued. Let's try that again.
Are you happy with your libido right now?
Yes, I feel comfortable talking about this.
Yeah, alright. Nailed it.
Venceu, depois chorou, então fui eu quem consolou sua tristeza.
Difference between this